Hi everyone, and in this video I'll be discussing a topic called chelating agents. So, what do you understand by chelating agents? Chelating agents are nothing but they are the drugs used for metal poisoning. So, many times we see metal poisoning, for example, iron poisoning, lead poisoning, arsenic poisoning. For that, we use certain drugs called chelating agents. So, chelating agents are drugs, and we use these drugs for metal poisoning. So we use these drugs for metal poisoning. Now, what is called chelating agent? The name chela stands for crab. Suppose there is a metal poisoning, these drugs will attach this everywhere. So it will attack the metal like a crab and they form a complex. So the chelating agent and metal will form a complex, and that complex will be water soluble, and that is excreted easily from the body. So that is what is the meaning of chelating agents. Remember, they are used for metal poisoning. Now, classically, we know a iron chelator. The name is called desferroxamine. The name is called desferroxamine. It is also called by one more name, deferoxamine. So it is also called as deferoxamine. Now, this drug is given either IV or IM, and the drug is a iron chelator. So this iron chelator, where to use it? It is used for acute iron poisoning. It is used in acute iron poisoning. That is one thing. Is there any other iron chelator we know of? Yes. We have oral drugs which are given as iron chelator, and the name is called deferiprone. It is called deferiprone, and one more is called defericerox. Now you read the name again. D means remove for iron. D for the iron. Same thing is here. D for. Now where to use oral therapy? Oral chelating agents are used. Particularly this iron chelators are used for chronic iron overload. So which patients will have chronic iron overload? Patients who undergo repeated blood transfusion. Which patient will undergo repeated blood transfusion? Patient who is having thalassemia major and they require blood transfusion repeatedly, then the iron load will occur. For them, we use it. One more iron chelator is called dextrazoxane. So dextrazoxane is another iron chelator. It is used to prevent anthracyclines. Anthracyclines. What are anthracyclines? The donrobopsin and doxorubicin induced cardiotoxicity. So they are used to prevent donrobopsin, doxorubicin, which are called anthracycline induced cardiotoxicity. So basically, remember desferroxamine, also called as deferoxamine. We have oral drug deferiprone, deferricerox. Desferroxamine, also called as deferoxamine. It is given IM or IM for acute iron poisoning. Oral drugs are for chronic iron poisoning, and dextrazoxane is to prevent anthracycline-induced cardiotoxicity. Very, very important. Then the other chelating agents are dimercaprone. Now it is also called as BAL. So what is the full form of BAL? BAL stands for British anti-lewisite. Now where to use this British anti-lewisite? Mainly it is used for arsenic poisoning. It is used in arsenic, mercury, gold, then bismuth poisoning. Very, very important. Particularly the arsenic poisoning, it is used. Now please don't use it in certain poison. What is that poison? It is not used in iron and cadmium toxicity. It is not used in iron and cadmium poisoning. What is the reason why it is not used in iron and cadmium poisoning? Because When the iron and ball they form a complex, the complex itself is toxic to the patient. So that's the reason in case of iron and cadmium poisoning, British anti-lewisite, also called as dimercaprol, should not be used. Moving on to another drug, it is called as disodium editate. So it is also called in simple form EDTA, and it will chelate the calcium. So where to use it? If it chelate calcium, it is used to bring down calcium where hypercalcemia. So if I use it in other condition, patient will develop hypocalcemia because it will chelate the calcium. So the adverse effect of this drug is hypocalcemia. Suppose you want to manage other metal poisoning and you give this EDTA, patient will suffer with hypocalcemia. But if you give it hypercalcemia, no problem. But if you give it in other metal poisoning, the adverse effect is hypocalcemia. To avoid this problem, we came with another drug that is called calcium disodium editate, or it is written as calcium EDTA. So already calcium attached to this group, so there is no risk of hypocalcemia. So it is used in poisoning such as lead, zinc, and manganese poisoning. But remember, not used in mercury poisoning. It is not used in mercury. Hg means mercury poisoning. So that is about calcium EDTA, also called as calcium disodium EDTA. One more chelating agent we all know is penicillamine. So whenever we think of penicillamine, the copper comes to our mind. So it is used for chelating copper. So the copper excess condition is called Wilson's disease. It is also used in copper poisoning. Right? It is also used in mercury poisoning. And it was also used in rheumatoid arthritis, but not nowadays because we have better drugs than that. Now, after that, we have another chelating agent. It is called as succimer. So, succimer is also called by another name dimercaptosuccinic acid. So, this is used in certain poisoning, that is lead, arsenic, and mercury poisoning. So, remember as LAM, LAM. So, it is used for this poisoning cases. Right? So these are the chelating agents what we use in metal poisoning. Please concentrate on iron chelators, then succimer, then penicillamine. Very, very important. So that is about chelating agents. Thank you all.